Kamblu. I'm an advanced nurse practitioner working in United Kingdom. Currently, I'm working in general practice and accident emergency department. Since last 10 years, I've been working as an advanced clinical practitioner. I came from India, basically from Bangalore. So total professional experience more than 25 years. Okay.
Great.
So
we can start your session. Do you want to start with your pre-test quiz?
Yeah, that's right.
Okay.
Yeah.
Okay. So let me just launch that. Okay, I hope everyone can see. Let's take a couple of minutes and complete this. Are you guys having issues selecting an option? Okay, please select the options.
Hello.
Yeah, we can hear you.
Yeah, there's a problem with the selecting.
Yeah, there's a problem with the selection. I think that's since you are one of the panelists, you may not be able to select, but cannot see it on my screen. I don't know. I'm seeing people select options, so I don't know if it's only a problem for some. We've seen, we're seeing people select options, so it could be a problem with your system, Jeta Mondal.
Yeah, somebody can choose. I will. I will tell the
Answers.
Yeah.
Yeah. So maybe we'll close in 30 seconds. Let's just close in 30 seconds since we have to move forward. Yeah.
Yeah. First one is, the answer is pneumonia.
Okay. I'm just sharing the results. Okay.
The answer is, the first one is pneumonia. Sorry.
Yeah. Can you see my screen? The results? Yeah. Okay. I'll stop sharing. Not able to remove it. Just give us a second. Is the poll still visible to you?
Yeah, that's right.
Okay, I'm not able to close it.
Yeah. So the first answer is pneumonia. Okay.
Is the poll still visible?
Yeah.
Okay.
The pre-test report is available. Yeah.
Is it gone now?
Yeah, it's gone now.
Okay, great. We can proceed. Sorry for that. Yes, sir. Please go ahead.
Yeah. Okay, that's fine. Yeah. Okay, so I will discuss the pre-question and post-question together later on.
Yeah. Okay.
We can start now. Yeah.
Okay.
With the beginning. Can you the update this on PPD?
Yeah. Just you want me to bring up your presentation?
Yeah. First. Yeah.
Let me give us a second. I will just bring it up. Can you see it now?
Yes, yeah. Okay.
Okay.
Okay. Good morning, good afternoon, good morning, UK, good afternoon, India. As I told you, I'm Raghavendra Kamblu, advanced clinical practitioner. I was working in elderly, means older person in the past, about 7-8 years ago. Currently, I'm working in the general practice, the accident and emergency department. So as an advanced clinical practitioner means I'm a background is a as a nurse. I'm become a currently the after many years working as a nurse, then I'm become a the advanced nurse practitioner. So I took the 3 years master level advanced clinical practitioner study in UK. So then I updated as a clinical practitioner. The clinical practitioner means same like a the doctor role. So every day we need to be exam the assess the patient, examine the patient, clinical examination. We need to be diagnose the patient, and we need to be discharge the patient independently. Sometimes we need to be discussed with the senior uh, clinicians or consultant. We are working part of the senior nursing team and the part of the medical team. So we are in between the both, we are doing the advanced clinical practitioner or advanced nurse practitioner. We are doing the medical role. So same responsibility as a medical person, as a same clinical responsibility, same the what clinical decision we are making in the within the workplace, that we are same responsibility, same legally and clinically. So we need to be doing the the clinical assessment. We need to be doing the appropriate assessment, examinations, clinical investigations, and the treatment and discharge the patient safely. That is our process, the daily our nature of work. Okay, we can go next slide, please. Yeah, the objectives of learning, the objectives of this, the clinical decision making, the session, to understand the meaning of the clinical decision making, understand various process involved, purpose of clinical decision making. So understand effectiveness, the what happens if you make the wrong diagnose, wrong decision making. So what is the consequence, to need to be understand, and how we can implement the whether you are a nurse, whether you are a practitioner, whether you are anybody, we are all at a different level of the skill and knowledge. We are implementing our skill and knowledge, making the decision. So the depends on the the decision making will we will get the positive or negative outcome. So the we can understand through the scenario from the this session. Okay, what is the decision making? So already I said decision making is a simply the process of making choice, but decision making often isn't easy and can be particularly complex in organizational context. So for example, every day, every individual making the decisions. So whether you are personal, whether it's a professional, whether it's a friendly, whether it's so we are making every day decision. But when it comes to the professional, when we are working as a nurse or whether we are working in the any any role, we are doing the professional decision. When we do the particularly about our personal life, also we do the career, or the what we need to be studied, what we need professional we need to be choose, where we need to go. We are making the decision making. So when this is the decision making, it's not a clinical decision making, the personal decision. So the next we can go for the next slide. Yeah. So I told the in front of us when we making decision making, so many route is there. Which is the right route we need to go? Which is the right way we need to go? So when you take the right choice in the right time, right way, and you will be going to succeed in your personal, professional, or any the successful in front of you. If you take the wrong decision, wrong choice, you're not able to achieve what you want to achieve. This is the yeah. Next one. What is clinical decision making? We are all clinicians. So whether the healthcare assistant, whether it's a nurse, whether it's a doctor, whether it's anyone, consultant. So we are all working with the clinical environment. We are all professional. So when we are making any decision related to the clinical means with the patient, so that is could be decision making. Okay. So for making the clinical decision making, there is a systematic approach will be there. So the decision making can be from the fast, instinctive, or heuristic decision through the well-reasoned, analytical, evidence-based that drive the patient client care. So for example, okay, next we can go. Yeah, when we are making the professional decision making, we need to be, the purpose of the clinical decision making, we need to be do the right diagnose, management of the patient properly, safely, and we need to be avoid mortality. So mortality means to prevent death and improve the professional standard. So improve the patient outcome. So the right diagnose, the people are making, when we are making the clinical diagnose, if you don't make the right diagnose, you want to make the right diagnose, you need to have the appropriate skill and knowledge, experience, education background, and previous, the similar practice, because you are working in the clinical setting with the patient, and you need to be have that experience, which will make you enhance your knowledge and help you to make the right decision, right diagnose. So management of the patient as a nurse working with surgical or in the intensive care unit, the patient oxygen saturation gone down. So you need to make the clinical decision too, whether patient need oxygen or not, So you need to make the decision about it. Okay. So as soon as the patient oxygen saturation go down, suddenly you need to go and give the oxygen. That is the management of the patient. Okay. Avoid mortality. So the right diagnose, right treatment will help to prevent the death. So that is important. Improve the professional standard. So we are as a nurse or as a doctor, if you don't make the proper treatment, so your professional standard will go down. So whether the nurses working with the patient, she need to make the appropriate care plan, appropriate diagnose, appropriate care plan, and the appropriate discharge. If the patient is not ever done the proper clinical decision making, the patient, professional standard go down. She will get doctors get bad name. So the professional, ultimately, we will get the blame. Our professional standard will go. So improve the patient outcome. Outcome means, so whether we need to be discharge the patient with the right things and the right professional, the total overall. So the outcome need to become. So quality of life, the patient, if you treated badly, the patient is won't get sepsis or patient is get gangrene. If you failure to identify early, the patient quality of life will go bad and the patient will be going to, that is the quality of life need to be improved the patient. Use appropriate resources, whether in the hospital, we got a plenty of resources. So the use the equipment and the use the, the patient to, whether you can do the blood investigations, whether it's go to ABG analysis, whether you get, use ventilator, whether it's appropriate bed, whether oxygen, this is all appropriate resources you need to use. There are resources, it comes with the manpower and the resources available to use, technological available. Everything you need to be used appropriately. So allocate clinician according to their ability or skill. So the skill, it's, the trainee level, beginner, and this next level, someone is this knowledge, you need to be allocate as a team leader. You need to be allocate patient. If you come the trainee who is the student, you need to be allocate what student able to do that job, and you need to be allocate to the student job. You can't allocate the student to make the complex decision making. So according to the knowledge, you need to be allocate the staffs and take their work. That's the manpower, the allocation and extract work from them. That is the important in making the next, please. Yeah. There are few steps, the involving the clinical decision making. One is critical thinking. It is brainy work. You need to be use your knowledge, your, the way of thinking, the critical thinking. So the next one is clinical reasoning. Clinical reasoning involve the process. The next is clinical judgment. What outcome from the clinical reasoning, then clinical judgment. We need to be make this one. We need to not to make this one. We need to be give the oxygen or not to give the oxygen, or whether we need to be give the treatment or not. The overall is involved in the clinical decision making. Next, please. So the critical thinking, the define critical thinking as a purposeful self-regulatory judgment that uses the cognitive tool. Already I said, it is our, the brainy work. So interpretations, you need to be interrupt the blood result, interrupt the, any scam result. You need to have the knowledge. Analysis, you need to be have the analysis skill, and you need to be have the ability of the evaluations and the explanations of the evidence, evidential, and the using the methodologically, all this, the total overall process is critical thinking. Next is in the critical thinking nursing process, you can see when the patient comes, the first front door is a nurse. The nurses is going to be see first before the doctor. Nurses is doing the, they communicate with the patient. She started initial assessment. She's doing the observations. She is find out whether the patient is blood pressure low, heart rate is high, oxygen is low or not, whether she need to be take initial actions, in the assessment. So validating data and organizing the data and categorizing the data, that is the important in the assessment. Next is analysis. Analysis, diagnose. If the patient comes with the respiratory problems, so we can come with so many differential diagnose. As a nurse, I want to tell you the altered respiratory, the whether with the respiratory problems, we can make the nursing diagnose, the altered respiration, and we need to be, the finding the problem in the relationship, why the patient is respiratory altered, whether it's gotten, what is the related to the medical diagnosis, whether it's got a pneumonia or the patient got a pulmonary embolisms, or what is the, the medical view and the nursing view. We need to be look at what altered, the problem is that pain, respiratory, the any problems, we need to identify that one. That's the diagnostic, starting the problem. So nursing diagnosis, because of the problems or symptoms, we are making the nursing diagnose. The medical problem diagnosis, it is come out of the clinical investigations and the outcome of the clinical, the uh, total judgment of the, the diagnose. So the next is planning. So the whether it's a respiratory, altered respiratory problems, we need to make the comfort positions, whether we need to be, whether we need to give the oxygens, whether, we need to be plan it in the nursing, the according to the diagnose, what we done. The medical, planning, what we need to do. So the, whether we need to be give the, treatment, what treatment we need to do, and how to treat, that is the medical planning. So implementing, applying the knowledge, because what we studied, what we practiced in the, previous. So the, that one, what actions, what medication we are going to be advised from the doctor to give the patient, or as a practitioner, we need to be apply the knowledge, what we studied in the past. So the nursing and medical, we are working both together team, and what nurses doing the, the implementing their knowledge and skill for the patient. The medical side also similar, we do that one also. So the, and end of the day, the patient need to be get better, the valuations also. So the, whether you give the oxygen, patient respiration is better, so we will recheck the patient, and we need to be do the ABG or VBG, we will find out the outcome. The similar way, the medical side, after the treatment is better or not better. We need to be, make the, the evaluations according to the patient outcome, final judgment. Okay, next one, please. So the total, the process of the, the part of the clinical decision making, after critical thinking, we need to be look at the clinical reasoning. What is clinical reasoning? Everybody thinking about clinical reasoning. Reasoning is very important to make the clinical diagnosis. So the clinical, the reasoning is, the is, the patient, we need to be, the numerous clinical skill, including the, we need to be take proper history, reviewing the patient records, perform physical examination, and choosing appropriate investigation, and provide prescription medications. And, the next discharge. This is the process, from the beginning to the end. That is called clinical reasoning. Okay. Next, please. So the element of the clinical reasoning. So the clinical reasoning element is history taking, physical examination, using interrupting diagnostic, understanding the cognitive bias and human factors, thinking patient-centered EBM, and shared decision making. Okay, next. Okay, so the clinical reasoning principles. When when the patient came, we started the clinical reasoning. Okay, clinical reasoning is, we need to be, there are some principles we need to follow when we do the, so the new knowledge is best acquired in the context application of that knowledge in the case-based learning, mentorship. Along with the factual information stored in the long-term memory, the learner continue to develop memory scheme, presenting related in the clinical problem in the reason study. So we are the working in the healthcare team. We got plenty of team members. For example, if you look at nursing side, nursing, you can get the first year student, second year student, third year student, fourth year student. Again, you get new nursing staffs or experience, few years experience staff and senior nurses and different grades. So when they are in the from the medicals, they are got a trainee practitioner, nurse practitioner, and the experienced practitioner or consultant, registrar, junior doctors. They are all have the different knowledge and skill according to the their level of knowledge. So everybody can't make the clinical diagnose, and the only experienced clinicians or they are able to make the good clinical diagnose. In the nursing point also, the new nursing student, see, struggling to make the nursing diagnose, because unless you don't have the knowledge and experience, she can't make the nursing diagnose. When we are the knowledge, when we the principles is this new knowledge is best acquired in the context of application knowledge. In the case, when we practice it, so that we can get the knowledge to the mentorship. Through the mentor, we can learn. So when I was working as a the student advanced clinical practitioner, I got a mentor. Mentor means who is a clinical supervisor. So she was the teaching me, because when I go and see the patient, I will discuss with my mentor, because until I signed off to do independently, I was supervised by the senior. When the mentor is who is experienced, who is a senior, and who is able to guide us. So we need to be learned from them. Okay. Along with the factor in the long-term memory, when you learn, when you see something, when you practice something, and your memory is going to be, you won't forget. And next time, if same thing happen, and you will go and do the actions. Because, for example, once you started to give the oxygen to the patient, when you go to the next time, patient is oxygen saturation down, automatically you go and start the oxygen, because you learn the skill and knowledge in the previous experience. That makes you to more, it will help you to make the clinical actions. That is the long-term memory. Okay, next one, please. So the clinical reasoning is a process, if you need to understand the clinical reasoning, one is the process, collect, process, and interrupt and action. Okay. In that process, you need to have the story, create the story. You need to go to the physical examinations, collect the history from the patient, physical examinations, observations, and test the result. So when you first the steps is to taking. Okay. So after the physical examinations, we need to compare the data and all. This is all comes in the process. Next is enhance the knowledge. First time I went to the from the nursing to the practitioner role, when I moved to there, I got all knowledge theoretical, but I had a knowledge of the nursing, but I didn't have the medical examination skill. I learned from the university how to do the physical examination. When we come to the clinical place, I find difficult to do it with the patient. So the first time, second time, the taking history and the repeated physical examination, and it will help me, after few days of my practice, then I was confident. So this is the way our knowledge will be going to enhance. Okay, next steps, please. So model of the clinical reason. So the model of clinical reasoning, there are two types of the one is Intuitive means process are very fast. Person making the click. So simply, I'm the wanted to tell you that. So the our clinic, senior consultant is suddenly, seeing the patient within few minutes time, he will make sudden a decision. Okay. And the junior doctor, he will need to be take the full thorough history, examinations, and they do the investigations. He will check the guidelines. He will take 2 hours making the decision. So the understanding the intuitive, and the rational, because the whoever, if you go to the, if you see the, senior, consultant, without, the just he is gather the information very quickly and making decisions. How? Because he got years of experience. He's seen this similar patient many times. He is the source of knowledge. He's got some knowledge and experience which will help him to make that decision. But rational, the junior staffs or junior doctors, less experienced people, they need, they will look everything to make proper, diagnose, because they don't want to make the mistake. Because it's a safety, patient safety is ignored, and they can't make the wrong decision. That's the rationale. Okay, next one. Okay, so we are all discussed about some ideas we got about the what is critical thinking, what is clinical reasoning. Now we are coming to the actually we are all in the the emergency department. We got a patient. We need to become to the the practical experience. So the without practical experience, whatever we learn in theoretical, there's nothing is going to means it's going to be stay in our brain. When actual situation comes, how we can make the the appropriate clinical reasoning, practically how can we make the accurate diagnosis. That's that's very important. I'm going to share this the scenario with you. So when I was working during the COVID time, the COVID, I mean the about the not now, it's about one and a half 2 years ago. So I was working in accident emergency department as an advanced clinical practitioner. Very busy environment. In that time, I saw a gentleman. He is about 80 years old gentleman who present with the 1 week history of the cough, shortness of breathing, pruritic type of the chest pain, chest tightness, low grade fever, mild wheezing. He has he's been using a salbutamol inhaler, not helping. Observation is, pulse is 110, blood pressure 100 by 60 milligram, the 60 mm, respiration 24, saturation 88 with the air, temperature 37.5. Past medical, COPD, DVT, arthritis. History of this gentleman, as he got seen by the general practitioner, treated with the salbutamol, suspected COPD, and also he got a reduced mobility and the 3 days gradually increased shortness of breath, not responding the salbutamol pain scale. Look at this data, so when I taking this history, or anybody can take this, you need to take this history appropriately, thoroughly, maybe a little bit more. When anybody you go to the clinical setting, don't take when you do the clinical case study, don't copy from the doctor's notes. You as if you want to future, you want to learn something, you need to take history yourself. You need to go to the patient, take the history from the patient directly. So what you need to be focused on the taking history. History, you need to be focusing on when this problem is started, how long he had these problems, and what are the main problems. So the whether he's got a pain, the pain is radiating to any other place. What type of the pain? Is a squeezing pain? Is a sharp pain? Is a puritic pain? Is a dull leg? You need to be focused on this tree. You need to be thoroughly, and you need to be use the ABI pain scale. The pain scale is 0 to 10. What is the mild pain? It's a 10 pain. Also, you need to be used where there is increasing pain when you mobilize, when you lifting something, when when you coughing, whether you're breathing. So you need to be have the thorough, is this patient? So the patient has got a, the puritic type of the pain when we ask, and you got a shortness of breath. How long shortness of breath? Whether shortness of breath increasing when you walk, when you stand up, you need to be asked all those important questions. And what are the aggravative factors? Whether is increasing when the walking, what is the so when this shortness of breath, whether it's a temperature is started beginning or whether it's cough is started next, whether it's the shortness, you need to be asked those things. When they cough, they're coughing with any flame, whether they're not coughing with the only dry cough, you need to be asked, cough is associated with the temperature, any breathlessness, whether wheezing, and whether it's, the how long you've been taken treatment. And you need to ask in the history taking format, the patient, the present complaint, the history related to the present complaint, and the past medical, allergy, and the any relevant hospital admissions, and you need to be family history, and all this you need to be correctly take that from the patient. Okay, next. So the physical examinations, on this patient, we need to do the general examinations, the patient appearance, whether it's communicating, talking, whether it's appeared a dyspnea, whether, the facial expression, you need to be looked at. Okay. Next is respiratory examination. Patient respiration is 24 and bilateral mild wheeze, crackles on the left lower lobe, tender on the palpitation of the chest. Next, heart rate is 110, JVP not raised. The heart sound S1, S2 is heard, normal sound, and bilateral lower limb is got a mild pitting edema. Abdominal is soft and non-tender bowel sound heard. Ambulatory saturation is 84 with the air. So you need to be examine the patient, the focusing on the problem. If this patient is got respiratory problems, and you need to be do the respiratory focusing the examination. If you do the respiratory patient going to do the neurological exam, there is no point. So when you go to the examination, when you ask the patient is got a dyspnea, whether dyspnea is related to the respiratory problems or cardiological problems. You need to be, by taking this history, you will come to the point of the conclusions. That is the time you need to do examinations related to the dyspnea. You need to be do the respiratory examinations and cardiac examinations, which is relevant. Going to the neurological exam is irrelevant, waste of your time. Okay, next we need to be, so the using interpretation and investigation. Okay, so I got all this information from the patient. Okay, so the blood investigations, only I put here is abnormal values. So the regarding the what investigation you need to do this one. So the investigation regarding to the respiratory problems, you can do the peak flow meter. I didn't write it down. You can do the blood investigation. You need to do the CRI, blood FBC, UN, uh, urea and electrolytes, and you do the blood D-dimer and troponin and the ABG. All this one we done, for this patient. Okay. Next, we need to be look at the ECGs. The interrupting the ECG, interrupting an investigation. Yeah, this one is next is blood investigation I done and ECG sinus tachycardia and left lower lobe consolidation and CTPA pulmonary embolism. Focus of problem justification of your decision. Okay. So the coming to the backslide little bit. Yeah, I need to go back to the history, from the here. Yeah. So I saw the gentleman who is presented with the 8 years old with the pleuritic chest pain. Okay. So when you look at the pleuritic chest pain, the pleuritic chest pain only comes with the pulmonary embolisms. Okay. And supporting the evidence of the pulmonary embolism, why I made the pulmonary embolisms, the diagnosis of this patient. The reason is when I took the history, the patient is immobilized and patient history of the DVT in the past. Okay, so DVT in the past and patient is immobilized and he got a swelling in the bilateral leg. So which is indications that the patient could be having the possibly pulmonary embolisms. Because of when you take the history of the patient, during the COVID time, the patient is coughing and you may think it is COVID. Everybody thinks when the patient comes to the COVID time, everybody thinks that, oh, patient is got a COVID. Okay. Patient got a chest pain. So normally everybody thinks that, oh, patient has got a heart attack. So that is the difference in diagnosis, Then we think the patient has got a pneumonia. Yes, patient has got the chest x-rays, the patient's ERP is raised and patient x-ray is left-sided. Consolidation is there. Could be pneumonia. Yeah. But why I need to be go for the this one. After x-ray, I went to the CTPA. I requested the CT pulmonary angiogram because the reason is this is the investigation. Make sure it will help you to the appropriate diagnose. When the nursing staff done the ambulatory saturation is why we need to we need to make sure the patient oxygen level is coming down, because when they walk, we are using the blood pressure machine and we are monitoring the oxygen. So specifically with the patient with the pulmonary embolisms, their oxygen saturation will go down. Okay. During the COVID time, so because of secondary, many people are got a pulmonary embolism due to the secondary to COVID. The COVID is made a lot of clot in the patient, That time, the ambulatory saturation helped us to diagnose, the pulmonary embolisms. So in that, the interpretations, you can see CRP is raised 40. And the patient, anybody get the CRP can rise it. It is the CRP is raised. The patient got a chronic arthritis. Still, CRP can rise. The CRP is up to 40. Some people will have because if the patient has got a arthritis and arthritis its inflammatory marker will go rise. But full blood, when you look at the WBC, it's not rise. So when we come to here, patient has got a slightly consolidated lungs is not going to cause this much respiratory distress. Okay, so mild consolidations of the lungs, the patient oxygen saturation is not going very low. But if you got a major consolidations, yes, oxygen saturation will go down, and it's got a breathing difficulty, dyspnea, everything, and it makes the worried. And the D dimer, that's a D dimer that is very important tool to diagnose the pulmonary embolisms. So that is rising, and the creatinine is slightly rising. I'm not worried too much about creatinine because the elderly patient, they're not drinking enough of fluid, and their slightly creatinine will go high. When we look at the ABG, you can see the ABG, the pH level, normally ABG's pH level is 7.35 to 7.45. When you look at the ABG, it will show that respiratory acidosis. Okay, and you can see the actual bicarbonate and the oxygen, pulmonary oxygen saturation level. You can, the oxygen saturation and carbon dioxide also rise. So when you look at the diagnose with the ABG, and you can see the pulmonary carbon dioxide level is high in the blood, and the pH level will go down, then you can make this respiratory acidosis. It is secondary to the pulmonary embolisms. So you can look at ECG, sinus tachycardia, and the X-ray. So already said consultation, and we can see when I done the CT scan, and it made me I got a right diagnosis. That is the pulmonary embolisms. When you patient with the elderly, they can come with the multiple problems. Sometimes we can make the more than one diagnosis with them, because they got a chest infection also. He got a the pulmonary embolisms, and he got a pneumonia also. Okay, next please. So the ECG, sinus tachycardia, it could be heart rate is gone high and the patient is dehydrated. It is once you give some fluid, and you can see the ECG will come back to normal level after but we have to be careful with the elderly people with the pulmonary bilateral pitting edema. The patient could be got a heart failure also. So you need to be careful when you do the IV fluid. So we need to do the IV fluids, and you need to be repeat the ECG again. That's very important. Okay, next. This is the important scale, DVT scale. Whether I don't know whether you are using in your clinical practice, whether in UK we are using this is very important tool to diagnose the DVT. When I looked at the patient has got a look at this scale. You can make the patient cough is swelling. The patient bilateral pitting edema is there. The patient has got a previous DVT. Okay, and when we looked at the leg, they got a pitting edema. So if it is more than we need to make this use this tool is very important. Okay, next slide please. Okay, the P scale. This is the very important scale to diagnose the patient with the pulmonary embolisms, and you need to be score according to the using the heart rate, and all this. Next one is please. Next slide. So the ABG, we need to be use the ABG. Please quick look that one, how to diagnose the ABGs when the pH level will go down and oxygen saturation. Now, as a respiratory acidosis, simple term is the carbon dioxide is more in your body. Respiratory alkalosis, you can see the oxygen saturation or carbon dioxide level low and the pH is high, and by actual bicarbonate level is low. Metabolic acidosis, it is pH is low and the carbon dioxide is low, and actual bicarbonate is a metabolic related problem is causing the metabolic acidosis. Metabolic alkalosis, this tool we use it to analyze the patient. Yeah, next one, please. The pH value is normal value. You can get, look that one. Okay, please, next one. So the thinking about, thinking, it is a brain work. So what is the possible diagnosis of this patient? When you look at that history, initially I thought it could be pneumonia. Then further, the thinking, further investigation, further, judgment helped me to make the various, the differential diagnose and the coming and the finalized, the pulmonary embolisms. So what investigation more required whenever which patient comes to your clinical area, you need to be thinking about it, how to follow up the, the guidelines. I use nice guidelines and the our trust clinical diagnose, the guidelines, and I justified my clinical decisions, bringing with the complex problems together and come up with the conclusions. Next, please. So the diagnosis and different diagnosis. When it comes to this main, so many the problems with the elderly. During the COVID time, I was thinking about COVID, pneumonia, myocardial infections, muscular chest pain, COPD. Final diagnosis, the pulmonary embolisms. So the heart failure also another, I put the question mark, because you got a pilotropitic edema, we need to be thinking about it also. Next, we need to become next slides, please. Diagnosis, you need to take the thorough history, physical examinations. When you take the history, you need to be come with the conclusion. When his patient says that puritic chest pain and the previous, DVT, you need to think about the pulmonary embolisms. Patient clinical system, symptoms and examinations, and the P score. I used the P and the well score, and the patient D-dimer and respiratory acidosis. The finally CT scan helped me to diagnose my, the beginning what I think I will come with the conclusions. Next, please. So the treatment, pulmonary embolisms, whether we need to be do the anticoagulant, to dilate the clots, we need to be use the nice guidelines and the according to that, according to the body weight, you can use there are different anticoagulant oral medication, apixaban, Davectron, edoxaban, and rivaroxaban. You can use all these medications. Next one, please. Discharge, you need to be use the safety netting and follow up. When you go prescribe the patient with the the treatment, the patient with the anticoagulant, he might have the bleeding from, so because the anticoagulant is diluting the blood, and sometimes they will have experience of the bleeding when they are going to the toilet, or or we need to be advise them when you got any bleeding from the nose, any bleeding from your stool, when any bleeding from your urine, and please contact us, the hospital or general practitioner. We need to give the advice also. Okay, next, please. So the understanding cognitive bias and human factor. When I was working with the busy accident emergency during COVID times, so many patients, we are all human beings. We got there's so many complex patient is comes, we are going to lose our attention, because so many patients we are seeing the every day in the practice, and we are sometimes our concentration level will go, and we will lose our patience, and sometimes we will make the mistakes. And secondly, individual motivation. When you are tired after working with the many patients, you will be more tired, and you will lack of motivation, and it will make you to the difficult to make the decision sometimes. And pressure from your colleagues, because in the emergency department, you can see 500 600 patients is every day input, and there are patients are waiting 4 5 6 hours, and you as a clinician, the practitioner or doctor, whoever, you will end up with doing so many work, and you will pressure, you don't have time to think also, that will cause the making the mistake. And the emotional, we are all human being, we will end up with so many different kind of the emotional, it will affect our making the decisions. Next please. Patient centered, so when we make the decisions, it depends on our individual clinical experience. Best the evidence from the guidelines, and we need to be consider patient value, their expectations. It will make us help the patient appropriate clinical decision making. Okay, next, share decision. When you make the decision, you need to be communicate with the patient. When you communicate with the patient, you need to be explain them properly, and you need to be understand their values and their family values. You make the discussion with the explain to them, and whether the patient is going to be have a terminal ill problems, whether they wanted to continue treatment, whether you need to make the plan for their end of the life care, whether the patient families, the emotionally, you need to be reassure them, and you need to be discussed with the best interest meeting within your team, and you need to become with the final decision maker, whether we need to be make the decision make to continue, whether we need to discharge the patient, whether we need to be make the further, this is shared decision comes together. So you need to be give the choice for each individual. We need to be respect the patient value is very important. Next, clinical judgment. So you need to be clinical judgment in what many factor. It is not only individual. Sometimes individual need to be make the group judgment. So when you make the clinical judgment, you need to have the discussion with the team, and you need to be, if you are the junior clinician, you need to be discussing with the senior registrar or consultant and colleagues, your team members, your nursing colleagues, and you need to make all together, you need to make the clinical judgment and collaborative practice. Clinical, best outcome is the making the decision with the collaborative decision making is effective. You can't make any mistake. You are come with the end of the day appropriate clinical diagnosis and treatment and discharge. That is the very important. Reflective practice. When you do any clinical practice, you need to be have the clear communications, and you need to be have the reflections. Each time when we had a major incident in our places, or if the patient is respiratory arrest, or if the patient die, we do the reflective practice. We will discuss team all together. We will come out with what we can do the best for the patient. So and you need to be know what you are doing. You should have the knowledge of the clinical knowledge, which will help you to make the appropriate clinical decision. Okay, next, please. So the factor of decision making. So the one is, first of all, knowledge and skill. First, knowledge is, I want to say that for knowledge and skill depends on you. You are motivated to learn. You can learn from any sources. Nowadays, very easy to learn. You can get the from the internet, you can from the clinical practice, you can learn from any sources, and you can go and approach your teacher, or you go to the when you go to the clinical the area, you can attend the ward rounds and everything. You can knowing yourself, you need to be understand your ability. So the whether you are the whether you are able to make the decision or not, and then you can learn and you can do that one. Using appropriate policy and guidelines, that's very important. Evidence-based practice is important. Evidence-based practice is previously somebody done the research and they successful, and the evidence, you can get so many evidence, they related to the subject. Okay, and knowing the patient and person, and you need to be understand. If you see the previous this patient, and then you can see the same. If you see the managed with the one myocardial infarction or one angina pectoris, one respiratory infection, then you can make the same similar situation comes, you can make easily diagnose and make the decision. And you need to be understand the environment where you work. That's very important. Next, so the bad decision making. So the poor patient care. If you done the wrong diagnose, wrong treatment, then patient end up with the morbidity or mortality. So it will reflect on your professional. The people will tell, oh, the nurse done the diagnose or nurse done the treatment. So because of that, patient just died. Poor professional outcome. So the look at your professional, everybody will come out in the the people public. Patient is they come from the public, they will spread the news to the many people, and our standard of the professional standard will go down, and the wrong diagnosis and treatment, patient death already and the end of the day, if you done the any wrong decision or the treatment, you will end up with the investigation. Maybe you will lose the the registration of practice. And where for the nurses, nursing investigation, and the medic practitioner or medical, they will end up with another investigation. Okay, next one please. Finally, good decision making help to improve qualitative care. Students should have the updated skill and knowledge. Evidence-based practice is always safer. Every action should be justified. So I want to tell you finally. So the one is the whole clinical decision making process. One is, as a nurse from India, I'm working as a clinician. Okay, at the current level. So the nurses can become do the medical role by updating their skill and knowledge. So the end of the day, what you needed one is clinical skill and knowledge. Clinical skill and knowledge by study or by go to university, and the by practice. That's very important. So the doctors and nurses, we are called as a practitioner, and the doctors called as a because doctors is only title. Anybody, we need to be called them medical practitioner because they are from the medical background. They secured that title. So the practitioner and doctors, we are doing the same job. We are called as a clinical practitioner. I mean, we got the same clinical responsibility. same as a doctor. So we both are doing the clinical examinations, clinical investigations, diagnose and treatment. So we are called as a, many patients are calling us a doctor. Is a doctor is who is able to do the diagnose. That's called doctors. So the end of the day, if you are all come from the nursing background, one day you can be advanced nurse practitioner or advanced clinical practitioner to go for that further study and further practice, and you can uplift your professional through the by education and practice. That is, this is so many things need to be discussed, with the each element, but I didn't have it, not, this is the time is not enough, the thorough history taking, how we need to be take the proper history, how we need to be do the proper examinations, and how interrupt with the complex, in this scenario, so many things I need to be discussed or interrupt, how I eliminated each problems, making the pulmonary embolisms in the first instance when the patient came, and how we need to be differentiate different diagnose according to the patient history. By history itself, we can make the possible diagnose and the investigation, and how to make the different that one is needed, each subject is needed, more time. This is and I would like to thanks to the Dr. Nand Kumar and Samya, so they gave me, the opportunity to discuss about this one, this the share my knowledge and with you people. Thank you.